Good afternoon. This is Dr. Bill White again with the American Orthodontic Society, and we've got stuck on the TMJ problems that we have, and I wanted to straighten up as much as I can how we've done that and how we work with it today, except I am retired and quit working with it, but I did about 30 years of TMJ work along with about 60 years of orthodontic work before I retired a few years ago, and then we started these videos. Now, as far as I could tell, there are three main sources of problems that cause jaw joint problems, jaw trouble. One of them is trauma, which is obvious. I mean, you can get in a car accident and you get pop your head back so hard that it hits and tears some of the ligaments. Yeah, my niece got hit with an elbow playing basketball and just knocked the fool out of her lower jaw, and she had jaw pain with it for quite a while. Most of this trauma will heal itself and get over it. And this type of problem that you have works good with anti-inflammatory drugs or massaging and working. In fact, if you get hit real hard with it like that, get some ice pack on it sometime. Keep it from swelling up, because the retrodiscal tissue, and I've just finished a video on here, will show you this tissue. And if you jam the jawbone back and the head of the condyle is mashed into this highly vascular retrodiscal tissue that supplies the synovial fluid, which is the lubricant for the joint, and also the food that goes to the tissue in the joint. The middle of the disc is a biconcave deal, and the middle of that disc there are no blood vessels and no nerve tissue in the middle of this disc, so it has to be fed by the synovial fluid, carries the food, then carries the waste off, takes it back to the blood supply where it's a very highly vascular area and can be damaged very bad, and I've had that. I have been knocked around skiing in different places, and I've had it so sore you couldn't hardly touch them. You can't touch the joint over there. Well, I can get buried up in that thing, and I've got a lot to say tonight, and I want to skip over that, but the trauma can come out and can help. You can help it massaging and everything. That makes everything feel better if you're massaging even down to your feet. And then we have stress that is mixed with that. In fact, stress can be in jaw position too. The third main cause of this long chronic pain that people have is just simply this is a thing that is a jaw position, and these people have reason for having their jaw back. They can't bring it forward, and I want to show you several of these things that happen. I want to even show you Dr. Mike Worley, who I worked with for about 12, nearly 13 years after I retired from my office. Okay, all right. This is case number 1, and it's a class 2, division 2, and that type is pretty well established. It locks the jaw back like that. This is a beautiful young lady, and she has a class 2, division 2 of malocclusion. In other words, this chin should come out to something like that, but it doesn't, and that's probably further than it should be. But this lady had a jaw joint problem, and what it was, the upper teeth come down like this, and the lower front teeth are up in here, and she could not move her jaw forward. Now this is where the cuspid should be, down this line right here, but the jaw is that far back in there. And for me to relieve her jaw position back here and get the head of the condyle off this area of the retrodiscal tissue, go look at that video. It'll show you all that. And we're going to show you a lot more about that now. Now, I wanted to move this jaw forward, and I knew it would solve the problem. And for me to build a splint, I'd had to have the jaw moved out this far out here, and that'd be right in the middle of this. So I talked to the young lady and her mother and said, if you'll give me just a short period of time here, I'll move these teeth out of the way and get them up here, and now your jaw can come out to where it wants to. By the time I did that, the jaw pain had gone away, but I used a splint to make sure I was there in that position. Now there have been, as a national speaker, I heard him 3 different times. And then I had a class of my own I was teaching, and one of the dentists that was taking my seminar also took this guy's seminar, and he told me he was there and saw this happen. There was a lady came in from Ohio, he was in Alabama somewhere, and brought her husband and everything, and she said she had been in pain for 10 years. And this guy deadened this lady, and he took a drill and cut the 2 centrals off. I mean, cut them off, and did root canals on them and everything. Sent her back to the hotel. She came back the next morning and hugged the guy's neck, says the first good night's sleep she had had in I don't know how long. What a drastic thing to do to somebody just because you didn't know how to straighten those teeth up. If you just moved them up out of the way, it's done the same thing for this lady. And I'm going to run through some of her slides here and show you where we did that. We actually put braces on, and in a very short time, this is out of focus a little bit, but this is an intruding wire that goes way up like this, and we put a flexible wire in here. It goes down like this, it catches these, it comes back up. But this main wire we bent down to here and tied it to those teeth. And in 2 months, these teeth were back out like they should be. Let me see, it's just about 2 months. I may have been stretching that a little bit, but there's the way it looked. Now, I got the thing too long, and so I made it shorter and pulled it down and tied it with this clear plastic little chain elastics. And now this is picking this up right here. This is 12/28 of 87. I have this whole deal. You can go back and look at any of these cases from start to finish if you want to. All right. We let this alone. So 12/28 of 87. In other words, December the 28th is where it was. Now, we watched her, and I moved those teeth, and without hurting or just really tearing things up or anything, we did. This was like 12/28 of 87, and here it is, March the 15th. In other words, it's 2.5 months later. Here are those teeth right here. Now they moved from this point right here that was holding the jaw back and moved about like that. Now the jaw could move forward. Well, what happened to the TMJ problem? The TMJ problem virtually went away, but I had already started making her a splint, and we went ahead and made the splint and put her jaw in exactly where we felt it had to go. That's out of focus. But there, we'll put this splint in there. I think they're here. The splint is in place, holding the jaw out. I really didn't have to have it, but since we're working about splints too, the splint, see, is real thick in this area, and it hits right here and thick over here. We take the load off of the jaw by moving the jaw forward, and it takes the load off of the joint back here in the back, and you'll get relief from the TMJ pain. All right, I'm going to go on pretty fast here. Now those teeth are out, and they were about that far from there. Now they're out here, and that's what we're after. And that relieved this, that the pain was coming from the jaw bumping into this retrodiscal tissue, and that's what we wanted to get rid of. All right, let me go through this, and we'll get on the next case. Now this is Dr. Whirley, and he doesn't mind me using his name, and I'm just going to spend a few minutes with him. And I first met Dr. Whirley, and I went out to dinner with him, and we were there at the dinner table, and he would bite back your teeth back in this area. He didn't have his braces on, of course. He had nothing on, and he bit back in the back. And then he'd move his jaw out like this and bite, and then he'd go back like this and bite. And I asked him, I looked at him, I kept watching him, I said, what in the world are you doing that for? And he said, well, when I chew back in this position, my jaw hurts. I mean, it hurts, the temporomandibular joint problem comes up. And so I move my jaw forward and close out here, and the pain goes away. In other words, he moved his jaw from, this is the back position, and he moved his jaw out to the forward position. Let me get there. I should have had that. Oh no. Anyway, we moved his jaw out, and he would eat this way, and his jaw didn't hurt. He would go back here, he could chew better, but his joint hurt. And so this shows that he pulled his jaw forward. That pulled the head of the condyle out away from this retrodiscal tissue, which is the real source of, to my case, to the majority of the problem that people have with that. And so we tried to advance his mandible and get it out there where he closed like that, and his jaw could come to that forward position without him putting his lower jaw out in front. You can see he wears that retainer with a bite plate, and that holds his jaw right there, and he doesn't have any pain when his jaw stays in that position. All right, let me go on to the next case. This is a real sweet lady. I've worked on her family and everything, and she has a terrible deep bite. In other words, let's get down and you see it. When she closes too, you couldn't even see her lower anterior teeth. And so her jaw was being squeezed back further than it wanted to go. And if you opened her mouth and let her bring her jaw forward, it wanted to come out to here somewhere. And this leaves a gap this big back in this area. Now when you bite your teeth together, you bite the teeth together here, the load on the muscles working in this area is on the jaw joints and the front teeth here. And the muscle is real close to the jaw joint, the masseter, the muscles that we chew and really work with is real close back there. So more force is put there than it is up here. Like if you had 10 pounds of force up here in the anterior part of the mouth, you may have 20, 25 pounds of force back on the jaw area because the muscle's that closer to it. It's just like your elbow right here. If I pick up 10 pounds, that ligament in there takes more than 10 pounds, a lot more. It has to be a lot stronger than that. So this is another case where the lower jaw is being forced back and it's pressing into this retrodiscal tissue, and this lady was having discomfort with it. And when we fixed her teeth up where it was lined up there straight, there was virtually no pain at all, and we let this patient go. And let me show you her finished case. And we come right here. I've got a lot of pictures in here that I should jump over. But here she is. I think that's where we finished it. That's where it was. And we finished that where these teeth right here were down here, and the jaw couldn't come where it wanted to be. And so now the jaw comes out where it wants to be, and it has no TMJ pain whatsoever. And I've watched this lady for years, and that's the way it goes. I've got, in other words, we had to crown a couple of teeth for her to get it out there. Now, case number 4 is a guy that must be a brilliant guy. He kind of ran the computers for American Airlines to handle all the tickets and all that stuff, and he was in charge of a whole bunch of people working with computers. And I thought, well, he's got stress, and that stress is causing him to have this pain. He was having so much pain he couldn't hardly carry on his work. And so I thought it was almost totally stress, but I was fooled. It was not totally stress. Now, when he bit his teeth together, and you look at the lower front teeth, he had ground them off to a sharp edge there in the front of his mouth, and they were round like that. Now, I had to depress these teeth, and so we've had to put bands on them and fill it with composite and push these teeth down and brought the upper teeth up and freed them up where this jaw could come forward, and he lost the pain. The jaw pain went away when we did it. So he was able to take the stress of this work that he was doing if I got the teeth fitting together right. Now there you see these teeth were down here somewhere and had worn this out. I'll fill those with composite and build them up, and we open this with this arch wire going down here, and the guy sent him in, crowned those teeth, and the guy's pain left him. And now he looked like that. There are the crowns on the teeth, and now I had the jaw open, and we had room for the teeth to come through. We didn't take any teeth out on him at all. These teeth, when I got the jaw down here, I was able to open this gap and bring these teeth out into there, crown these teeth by just simply opening the bite, something like that. You see, you could bring it out to that point. And when I moved his jaw where it needed to be, the discomfort and the TMJ pain, and he had been taking medication. He'd been to many doctors and looked at him, and they would see this headache, the shoulders, the neck, everything's hurting. If you keep using something that's in bad pain, it will get out all over your body. And the same thing is true about your vocal cords. If you continue to use vocal cords that are inflamed and sore and swelled, you'll have pain in your neck, your headaches, shoulders, neck, and everything the same way. My granddaughter's is a singer, and she's had that problem. And I'm real proud of her. She's in the Dallas Symphony Orchestra, not a singer there, but a percussionist. All right, so here we open those teeth up, and we put those teeth in there, and the pain went away. Again, it was the pressure on this retrodiscal tissue that brought about the pain. Now I've come up to another guy here that I've watched for about 20 years. I'm sorry to speed through this, but if you're really interested in this case, I've got every one of these cases in a video that's going to cover it from start to finish. Now, number 5 is a guy who had a job that it was hurting so much that he took so much medication he was about to lose his job. And so he was hurting. And we looked at his case. He's got a deep bite like the rest of them. And he has a crowded situation in there. And we opened that bite. In other words, we just developed this out and opened this up and made room enough for this tooth down on the bottom to come through. Now down here we were able to enlarge this, and it gave us room to get this through. And I used one of these Big Daddy arch wires on the bottom to pull that tooth into that space. And let me see if and then once we got that free, his teeth that were down here or up there, he's got room for these teeth. He wears a retainer. The pain went away. Whatever stress in his life wasn't enough to force him into this pain. But stress has a part of it, and I've had some cases that it was totally the reason for their hurting. But it's not as much as I thought it was. But the vast majority of the people that I got serious pain problems with had a position of the jaw that was giving them the trouble. So we moved that tooth in position. You see, we opened this up, we opened this bite, and we moved these out, blew that in. Now the jaw could come out here where it wanted to be, and it was happy there. He has no pain with it. I've followed this guy right on through till this was 1983 when we went in there, and I think we followed him into the 2000s, something like that. And here it is, 83. We had him finished, though, in a couple of years. But now he is wearing his retainer. You can see where the lower front teeth kind of wore those teeth down up there in the back when he was closing up underneath there. And there's the retainer we had, and I made a little ramp on it so he had to get his jaw in that position while he's wearing this retainer. And that kept his jaw where it did not hurt at all. And let me speed through this. Sorry it takes so long, but this guy was wearing a wig, and we seen him there in 93, and it was 82, something like that. So this is 10 years later, and there's 82 to 93. There's about 11 years that we watched that, and I took pictures of it. And I think I have some stuff in here later than that. Yeah, now here is 04. The guy is still doing good in 04. And I think I can say without stretching it too much that we were able to take care of the pain in every patient we got. Now that's just an accident maybe, but we went after the source of the pain. And the source in many of these is this retrodiscal tissue. And if you keep chewing, and every time you swallow, it presses on that, and the muscles and the whole thing just kind of give up. And then you get all this pain in your neck, shoulders, and your headache. And the same thing happens with inflamed vocal cords. The same kind of pain happens with that. So this is something to think about. Now it's fine to do these massaging, and you get hit, you better get some ice on it, keep it from swelling if you can, and that will help, but it's not the major thing that the people that I saw that had drawn long-term pain had some problem back in the joint. And you put your fingers right here in front of the earlobes and move your jaw around, and you can feel around it. And people with a lot of pain in there, you can't even touch them. And mine has been that sore too in other people. All right, so I think I'm going to close out here. And this guy's older, but he doesn't have any TMJ pain. Now, this is 04, and we started in 82. Anyway, we've been watching him for years and got to be good friends with him. So I like that. So anyway, there he is in 06. He lost a tooth, and they're fussed at him for not putting the bridge on it. And there's his upper retainer. He's still got it, and he's still not having any pain, but I said, get you a tooth in that gap right there. And 07, I don't know when we stopped seeing him.